So in the last month, San Diego County hospitals have seen fewer patients with serious and sometimes life-threatening conditions coming into the hospital emergency departments and the urgent care centers due to concerns about contracting COVID-19. So joining us now to talk more about this issue is the Chief Medical Officer and Clinical Excellence and Experience for Scripps Health. It's Dr. Ghazala Sharieff. Good to see you, Doctor. How are you?
I'm great. Thanks for having me on.
It's our pleasure. You know, I've spoken to my family and friends about this. We say things like, make sure you don't get into a car accident or slip and fall. Don't cut your finger cutting the vegetables, because the last thing you want to do is go into an emergency room or something like that where potentially people have COVID-19. But this can be really serious, right? If there's somebody who's maybe having a heart attack or a life-threatening illness.
Yeah, absolutely. Though you pegged it right away. I'm very concerned about the volume. We expected some of this, as you know. People, as you said, people are not going out and driving as much, so we're not seeing the car accidents. But our concern is the patients who do have chest pain or stroke symptoms. If they're waiting to come in, time is literally ticking away, and so if they wait, that could be a devastating outcome.
So what do you tell them to encourage them to go to the urgent care, to go to the ER if they're having an issue like that? What are you doing to protect them?
That's a great question. We're being very careful. You may have seen that we have triage tents outside our emergency departments and our urgent care centers. So we're separating the respiratory symptoms from everybody else. They get screened. They get a mask put on them if they have respiratory complaints. And so we're being very careful about separating our patients out. And our staff has been wearing protective gear as well, including a mask and a face shield. So it's very safe in our emergency departments and urgent care centers.
Yeah, I want to make sure that the doctors and the healthcare workers are safe as well. Can you just take me through what the actual process would be if somebody's at home and maybe they're having an issue breathing or chest compressions? Do they call ahead, wait in the parking lot, put a mask on? How does it work step by step?
So if you're having severe symptoms that you just described, you're having severe difficulty breathing, severe chest pain, radiation down your arm, you really shouldn't drive yourself, right? That's a 911 call. And I can assure you that the paramedic rigs are doing a very good job as well of protecting their patients and their staff as well. So that would be a 911 call. If you're not having severe symptoms and you're wondering, should I go in or should I not go in, you can definitely go to our website. You can call it. We have a nurse triage line as well. Or you can call your doctor's office if it's not a medical emergency. But I do think getting care with 911 if you're having severe symptoms is actually very important.
Sure. I mean, the last thing you want somebody to do is just kind of walk into the hospital, I would think. I know you've got those tents set outside and they should probably wear a mask. At least do something like that so that maybe they can be isolated from other people who maybe have COVID-19.
Yeah, I really appreciate you saying that. I think what you said was very important, that we're asking our patients to wear a mask as well for their protection and actually for the other people that they're interacting with. But yes, you're right. If you're a walk-in patient, we will automatically triage you, again, separating you out if you have respiratory concerns at all. But yes, wearing a mask, and then our staff is wearing a mask as well.
We've done a number of stories on this telehealth where you can speak to a doctor through your cell phone or your computer. When would that come into play?
That's a great question as well. If you're having symptoms that you're not sure of, but you really are, it's severe symptoms, that's a 911 call. But if you're not sure, and actually it's for our patients who have chronic medical illnesses, so you have known cardiac disease, but you're not sure whether or not to go in, that's a great time to contact your doctor's office, and they might be able to set you up for a televisit. You may not even need to come in, but we definitely don't want those patients to skip an appointment, because you skip one appointment, you may not get your medications refilled, and then you do set yourself up for getting sicker, and then you have to go to the emergency department because you haven't taken care of your disease along the way. So contacting your physician's office is a great start, and then we can direct you as to whether a telemedicine visit would help or if you really need to be seen in person.
How is Scripps doing with having enough of the PPE, the masks, the gowns, the face shields, ventilators, beds? How are you guys doing in that regard?
We're doing okay right now. We anticipated a surge was going to be coming, so we cut down elective surgeries, the non-essential elective surgeries, so we have bed capacity. We are seeing increased volume in the south as well, and so that's something we're keeping an eye on. Currently, we have enough PPEs, but we are short on isolation gowns, just like everybody else is, and so we actually just put in our re-sterilization process for our N95 masks. We only hope to use those if we run out of the N95s, but right now we're okay, but everything is being watched critically, as you know, because the supply changes day to day.
Dr. Ghazala Sharieff from Scripps. We appreciate it. Thank you, doctor. All the best. Stay safe out there.
Okay, you too. Thank you very much.